Okay, Aisling, I got a press release from you and Access to Medicines Ireland last week about a new Oireachtas report that was published last week. Before we talk about that, could you fill our listeners in, for those who don't know, on who Access to Medicines Ireland are in general, please?
Absolutely. Access to Medicines Ireland are a voluntary organisation, a voluntary group of individuals, mostly doctors, academics, activists and concerned members of the public who are interested in looking at access to medicines in Ireland and kind of some of the global issues around that in the COVID-19 context. And we're also a membership group. AMI is a membership group of COLOV, which is the Irish Organisation for Development Workers.
Okay. And are you on the go long in Ireland?
So the last number of years, it was founded in Ireland, I think in 2017, 2018, and we've been working, or the AMI has been working since then around some of the issues around access to medicines in the Irish context.
Okay, and I know we're going to talk today particularly about COVID vaccines in developing countries, but could you tell me a bit about your work in Ireland before COVID, please?
So Access to Medicines Ireland was working around some of the kind of systemic issues around access to medicines and drugs for various conditions, some of the issues around intellectual property rights and other related aspects prior to COVID. And since the outbreak of the pandemic, we became increasingly concerned. Many of us were already working these issues in our own capacity, but also became increasingly concerned that some of these issues would likely come to the fore again in the context of COVID-19. And unfortunately, we've seen that happen recently.
Okay. So can you tell me where you are coming from in relation to the COVID-19 vaccines?
Sure. So in terms of COVID-19, I suppose when it was declared a pandemic over a year ago now, many people in the access to medicines space and many academics, intellectual property lawyers, health lawyers were very concerned that some aspects of the way in which the pharmaceutical system works could limit the supply of vaccines or could affect how vaccines, if they were produced, and thankfully they have been produced, how those vaccines will be distributed and whether or not there will be global equitable access to vaccines. So for instance, just an example of this is intellectual property rights like a patent right. What that does is it allows the person that has the patent, usually a pharmaceutical company or other entity, the ability to control who can produce the product that's under the patent, and also then potentially the ability to affect supply and also the terms, such as the price at which it could be supplied. And I suppose the concern within intellectual property circles is that if companies don't share the intellectual property and also on top of the IP, they need to share the know-how, the knowledge, the data in order to facilitate others to produce vaccines. What could happen is you could have a provider who could potentially increase the capacity for the production of these vaccines by sharing the technology and the know-how and the data, but actually may not facilitate that, may not be sharing it or could potentially share it further. So the concern around COVID-19 is to do with both the supply, the artificial scarcity that could be created as a result of these issues, and also global equitable access. And just so readers are aware, some of the statistics that have been produced include statistics by the People's Vaccines Alliance, which suggests that 9-10 people in many low and middle income countries will not have access to COVID-19 vaccines in 2021. And some in the World Health Organization, including Dr. Tedros Ghebreyesus, have highlighted that this puts us really on the brink of moral catastrophe if there is such a vast inequality in the distribution of vaccines around the world. And just also to add to this, the other concern is not just, it is of course an issue about social justice and access to vaccines, but also an issue in relation to a pragmatic concern, because until we have global equitable access everywhere to vaccines, the risk is that there will be a continuous threat of COVID-19 re-emerging, even in areas where the outbreak has been the virus has been brought under control, because you could have outbreaks re-emerging through travel, and you could also have new strains of the virus emerging. And overall, just really generally, even in recent weeks, we've seen the need to increase the supply and capacity for vaccines across the world. And some of the current initiatives, like the COVID Technology Access Pool, which Access to Medicines Ireland have been actively campaigning for, could be used to help facilitate that.
I know you spoke at the Oireachtas committee in recent months on your work, and the committee issued a report late last week. Can you tell me a bit more about this?
Absolutely. So yes, Access to Medicines Ireland, we produced a policy document actually in December of last year, December 2020, which was detailing some of these issues around access to vaccines in particular, but also medicines and diagnostic tests in the COVID-19 context. And that paper focused on a World Health Organization mechanism, which is the COVID-19 Technology Access Pool. And we were advocating within that paper about why the Irish government should formally support or endorse the COVID-19 Technology Access Pool, or CTAP, it's often called for short. And just to explain what that is, the CTAP is basically a one-stop mechanism which sets up a way in which intellectual property rights holders and companies could share their IP, they could share their data, they could share their knowledge and know-how in relation to these vaccines and also medicines and diagnostics, in the spirit of solidarity, basically coming together to facilitate greater supply and manufacturing capacity for these vaccines and other health technologies in order to bring COVID-19 under control as soon as possible. So that's a system that the World Health Organization are proposing and are seeking to set up, but it needs more support from pharmaceutical companies and also more support from states in order to encourage its development. And to date, there's about 40 countries worldwide that have endorsed it, but Ireland, as of yet, has not formally endorsed it. So that paper that we produced in December was highlighting why we should. We distributed that paper and were subsequently invited and delighted to be invited before the Oireachtas Committee on Foreign Affairs and Defence. And at that committee, I and Dr. Kieran Harkin spoke to the committee alongside Dr. David Navarro from the World Health Organization and Miss Winnie Beninyemi from UNAIDS. And we spoke at that meeting in particular around some of these issues around global equitable access, and we were delighted to see the committee make its recommendations and produce its report, an important report last week on these significant issues, and recommending, so the committee recommended that Ireland would formally endorse the CTAP of the Irish government. They recommended they would endorse it, that also the government would or should be advocating for CTAP and other mechanisms at an international level, particularly at the EU and the UN Security Council level, that the government would assist in encouraging more pharmaceutical companies to join CTAP, and there would be increased financial support for the World Health Organization's ACT Accelerator tools. And we thought those were very significant recommendations, and we were delighted to see that last week in the report produced.
So it's great news that the Oireachtas Committee have issued their report that they're in favour of it. But as you said a minute ago, the Irish government still haven't said whether they're going to formally adopt a policy, haven't they not?
No, they haven't yet, but we are very hopeful now that those recommendations were made last week that the Irish government would actually follow up on those recommendations and would move to formally endorse the CTAP and assist also in encouraging it at a European Union level and also at the UN Security Council level. So we are hopeful that that would happen as soon as possible, particularly given the significant issues that COVID-19, of course, poses in Ireland and all over the world at the moment.
Okay, I think you've already answered this question, but okay, what are you calling on the Irish government and indeed our listeners today on Near FM, Aisling, to do on this issue in the short to medium term?
Yeah, so given the significance, and just again to highlight the significance of the global inequity that's arising in this context, in January it was reported that just 16% of the world's global population of higher income countries, 16% would have access to 60% of the world's vaccines. So there's a vast inequality, and of course we know that even in higher income countries there are issues around supply of vaccines. So what we are calling on the Irish government to do is essentially to support the World Health Organization's proposed CTAP initiative, which would, in our view, facilitate a system which would share IP, data, know-how in order to increase both the supply of vaccines, medicines, diagnostics across the world, and also the speed of supply if it was sufficiently supported. But we think it's really important that the Irish government would, first of all, formally endorse that, so support the system, but then also advocate for other countries to support it, and also encourage pharmaceutical companies to work with the CTAP in the spirit of solidarity in order to bring COVID-19 under control as soon as possible. And alongside that, if those voluntary mechanisms are not successful, we would also advocate for there to be an engagement with the TRIPS, which is the World Trade Organization's waiver proposal, which is seeking to waive or to suspend intellectual property rights for the duration of the pandemic. And in terms of your listeners, I suppose just encouraging listeners to be to engage with some of these issues as well, to perhaps look at our website, accesstomedicines.ie, where you will see this CTAP policy paper is there and some of our recent press releases on these issues, and also to consider the need for actually greater discussions around sharing intellectual property data, know-how, and for Ireland to support the CTAP initiative to, in our view, help facilitate or help address some of these issues arising.